Philippines ranks as the third on the list of most vulnerable countries to climate change. The country is very much exposed to natural disasters. In 2011, Tropical Storm Washi with local name Typhoon Sendong hit the northern part of Mindanao. Around 125,000 families were displaced and about 1.1 million population from Cagayan de Oro, the Visayas and Palawan were affected. Additionally, women and girls were disproportionately distressed. Displacement, interruption to healthcare services, and loss of infrastructure seriously threatened maternal and newborn health as well as their family planning support. They were also vulnerable to sexual exploitation and gender-based violence. Thus, Family Planning Organization of the Philippines, together with other humanitarian actors, provided the Minimum Initial Service Package for Reproductive Health, or MISP for RH. It is a set of priority activities to be implemented from the onset of humanitarian crisis like natural disaster. FPOP built on the area's capital to recover. The affected population themselves, including the young people. Hence, they called for volunteers. Many responded, including the young people. They were eager to contribute in rebuilding their community, but they didn't know what to do. So they were trained. MISP was introduced. MISP youth staff from other areas joined them. They led a response in Washi's affected areas, particularly in Cagayan de Oro. The young people helped in mapping and coordination. They were also part of the reproductive health medical missions as health volunteers, educators, and facilitators for health information sessions. Further, they became peer educators when they went back to their communities, educating not only the young people but the rest of the population about their sexual and reproductive health. They became a vital force in rebuilding their communities. A year after, Tropical Storm Bofa with local name Typhoon Pablo hit again the southern part of the Philippines. Around 711,000 families are displaced and about 6.2 million population from Davao Oriental and Compostela Valley are affected. The young people from Washi's response were tapped as humanitarian staff for BOPA's MISP response. This is because of their training and experience. They joined the team geared to implement MISP in Davao Oriental and Compostela Valley without hesitation. Again, many youth survivors volunteered. New facilitators, peer educators, and young leaders were developed. Then, involving the young people in MISP response became a practice in other areas in need of intervention. Young people organizing and mobilization were part of the MISP response in Zamboanga, Bohol, and in Tropical Storm Haiyan or Typhoon Yolanda's affected areas. Hence, the success of MISP in the Philippines will not happen without young people's contribution and dedication. The young people take on two characters after a disaster: as a survivor and as a humanitarian worker. When humanitarian actors come in the community, they are blind to what awaits them. The youth survivors know the situation. More importantly, involving them will take out certain factors that confound their condition that may bring them to deeper depression and despair. Thus, if we want to empower the young people in crisis, awareness is not enough. We need to organize and mobilize them as well. They need to realize and live out their role as fundamental force in the society. We need to believe on their vigor and vitality. For young people are catalysts of change. Our hope is placed on them.